Jay, I apologize about that. I think the webinar, we got booted off. Oh no, I'm gonna text Anne. Hopefully, their attendees are joining back. So sorry about that. If you could pull up your slides, thank you.
It happens.
Hey everyone, I'm sorry for the inconvenience.
If you give me permission to share my screen.
Sure. Thank you, everyone.
It's a resilience test.
Absolutely, it's a resilience test. You can forward them if you can. We already went through the beginning. And since we're short on time right now, I'll go over most of this in the chat box. Thank you everyone for joining us, and we apologize for the technical difficulty. And Jay, I will briefly introduce you.
Okay.
So thank you everyone for rejoining us. We were abruptly booted off of Zoom. So Jay Ostrowski is the CEO of Behavioral Health Innovation, where he develops and deploys telemental health, telebehavioral health, and telemat programs and designs HIPAA-secure software applications such as adaptive health, telehealth. He also serves as a telehealth consultative and implementation partner for the Mid-Atlantic Telehealth Resource Center and is the director of the Telebehavioral Health Center of Excellence. So at this time, I will turn it over to Jay. And again, welcome everyone.
Thank you, Kathy, and thank you guys for joining me and tolerating the technical issues that happen sometimes. Some of them are in our control, some of them are not. Today, we're going to be talking about what to think about in your future planning and investment for telebehavioral health and digital mental health services. This is, as Kathy mentioned, a part of a series that we're doing. We have 2 more after this. We have a lot of background in previous ones that are also available online. My background, I'm a licensed professional counselor, licensed supervisor. I started in telehealth almost 20 years ago with an IP camera. The year that Skype came out, actually it was before Skype. And so I've been doing this for quite a long time. And part of what I do every day is provide technical assistance through the Mid-Atlantic Telehealth Resource Center and provide training and consultation. And there are a lot of free resources that we have and free consultation available to you. And that'll be available on one of the last slides as well for you. But I help develop a lot of these technologies and help people create them over time and create their service lines and expand them and grow them. And so I've encountered a lot of the problems that you may encounter in the future. And with that in mind, we try to put together some planning ideas for you and things that you need to be aware of to prevent a lot of that. So learning objectives are basically to learn about what are the opportunities, the challenges, what to consider, and then to discern what they are, foresee them, plan for them, put together the right team and approach to make sure that you get a really good service line or integrate telehealth or digital services in some way. We're saying this broadly because we're not sure what you're going to do. You might do one of many different things. It's likely you're going to do iterations and layers of things over time, and we'll of course get to that. So this is kind of those are the learning objectives. This is my outline of kind of where we're going to go today. We need to talk about why always to frame why we're doing this. We're going to talk about designing and developing, and then the kind of the different aspects of a project there. We did talk about finance in the previous one, so we're kind of staying away from that, focusing more on actually a lot of the operations and where things can go well or go wrong. So the first thing we need to talk about is why, and the why is kind of a big deal, because if you don't have a strong why, as soon as the going gets rough, you will abandon this and have wasted a lot of time and money. So you need to have a compelling reason why you will do this. So to me, that's imperative, and it helps you kind of get your head around where the priority should be. Likely, there are several different priorities that can be co-joined, but usually one would take precedence over another. because there are operational and design decisions that need to be made along the way. And when I say design, I'm talking about like program design or service design, or sometimes even software design. You're designing the future of what you want a workflow to go like or look like, and you want it to flow well. And sometimes that'll be sacrifices on one side or the other. And so you need to know kind of what are the priorities there. Some of them are pretty obvious to most of you. We expand access. We distribute our workflow force appropriately, because sometimes you might have too many providers in one area or too little in another area. And this is a way to level set that to make sure you have the right people in the right places at the right times, and connect clients to providers, and get rid of some of that downtime that is costly. And you want to kind of maximize their hours of all the provider time, and also look at different ways to maximize the learning and education and guidance that you're providing to clients, and give them digital tools to keep them on track, remind them of their appointments, and create some operational efficiencies, and give them tools to actually help themselves in different ways. But there are lots of different benefits from doing this, and we talked about some of those in previous. Today, we're going to talk about more of these how-tos, and but I just wanted to kind of go back to the why and make sure that that's always something at center stage. One of the biggest reasons why is the shortage of providers that we're finding. A lot of places now, there's a misdistribution of providers. There are pockets of places where people have too much capacity, and many other places where there's not enough capacity. And sometimes that's about what the payer mix is, or the client mix, or type of specialties, but we're projected to have shortages in the future. What I would recommend is looking at from a different kind of paradigm issue. Is we grow people, or we birth people in the world at a much higher rate than we birth providers, or educate and graduate providers. So the amount of licensed providers of any kind will proportionally shrink over time, just because of population growth. And so as we see that, not just in the US, but around the world, it's a growing problem. And as I work with different countries, I see the exact same problem. And so their solution is to come take US based providers and have them be outsources over there. So even though we have this shortage, we have kind of some poaching going on as well. So again, this problem of access is going to be here for a while, and we need to be planning on what we're going to do for it. So I would ask you, what problems are you looking to solve? I think this is the place to start. We're not just adding digital services for services sake. We want to solve some problems. And again, you might have several different ways of looking at this, and several different problems that you want to solve. What telemental health and digital services can do is it's connecting people and connecting data in ways that you haven't had before. And I'm not just talking about your EMR. There are many different solutions that can be added to your current services, or even a paradigm shift in some of your services on how you offer them. Going away from a fee for service and more to an accountable care organization model, or a cost sharing model, is where that's headed. Even with fee for service, though, you can add kind of layers of services that are digital tools that improve your quality scores, and include client retention, and get them to your appointments on time, and reduce no-shows. So there are, and it's kind of a competitive market, right? So in some places you provide better services and keep your clients happier and get more referrals, because you're connecting people with technology to better care. So also, as we're moving more into our collaborative care, these tools are imperative to connect people with the right providers, and stay connected, and share data and share information, so that we're kind of on the same page as a treatment team that works in a distributed way. So there are lots of different benefits. And again, you need to see which problems are you trying to solve. So with that in mind, I would recommend writing these things down in as grand detail as you can, because the more detailed you are about what you're solving, the easier it's going to be to get help and get those solutions. So when you're designing solutions, I want to start with kind of designing in general. We are a lot of times just approaching this like, let's see if we can text message our clients, or let's see if we can do, a clinical workbook, or let's just see if we can see them on video. And I think we need to step back from that and say that's it's a narrow approach to this. Step back from it and say, what's possible, and can I design this in a different way that would be in the client's best interest? There's a paradigm we call design thinking. If you Google design thinking, it's a way of doing project development in a way that really has the user in mind, and it kind of frees you up to think in new ways. A lot of us inherited a way of doing things in behavioral health, and we just keep doing what we're doing because that's what the law says and that's what reimbursement says to do in the rules, and that's what our colleagues do. But there really are other paradigms and other ways of accomplishing the same goals within the rules, if we think creatively about that. And so that's a lot of times we're called in to be a facilitator for design thinking, to help get the creative juices going and see how we can accomplish things in brand new ways, and really save costs and increase client satisfaction and provider satisfaction, because turnover is a killer to most businesses, especially in behavioral health. So we're focusing on kind of different ways of solving this, and sometimes we're actually focusing on a very narrow part, because as you guys well know, that one solution doesn't fit everything. And as you approach this, you can start having the 5% of the problem or the 10% of the problem kind of be the tail that wags the dog and makes something not possible. Whereas you could layer solutions in a way where one approach may take care of 80% of what you're trying to accomplish. Another solution might take care of 10% or 20% of the remaining. So you're kind of chipping away at the problem instead of trying to take everything into account, because typically if it's all inclusive, it may be more expensive than you want or more clunky than you want. There are all-inclusive softwares out there, but again, the problem might be that there's different access issues. And again, we want to focus on what's going to help majority of the people, majority of the time, and how do I make this operationally efficient, effective, and cost-effective too. So as you're thinking about the future, you want to include somewhat of what you have now. When you're working with a team, you want to have kind of near-term wins and long-term wins. And you start with use cases. So use cases we call them user stories, are, we want to have our clients be reminded of their appointments. We want our clients to show up on time. That's kind of this goal we might have. We want to make that into a story where a patient hears an alert on their cell phone, and they look and there's an alarm telling them to join their video appointment in 10 minutes. And that gives them time to go and use the restroom and do whatever they need to do to get ready for their appointment. That's a little user story. You can write these stories out, but each story goes with a different audience. So you have many different audiences, and we'll come back to that. You also can write out your workflows, and this can be kind of your current workflow, and then here's your near-term state, and then here's your long-term future state. So your solutions can really be in stages, where you have some kind of near-term wins that kind of iterate, where you can make lower cost investments and iterate into a longer term outcome. So many times on a project, we'll take on what's called agile development instead of a waterfall approach. A waterfall approach is where you design everything up front, you document everything up front, you think of everything you can think of, and you make one document, and you use that document to develop everything from. It's like the water falls down, and it's one way, right? It's all at once. An agile approach is a lot of little cycles where you're doing little things, you're developing, and then you're learning, and you're adding components to it with an overview of where you want to go. But the framework is kind of loose, and you have a flexibility of changing a tactic and changing things as you go, so that you're not investing in something that doesn't work long term. You're learning lessons and making sure your money and your time is very efficient. And you're kind of experimenting along the way. And my bachelor's is in experimental psychology, so that really fits with what I do. But I found that it's highly effective. And a lot of times with our waterfall approaches, the technology or the use cases change over time. And so a lot of times that approach of kind of planning everything in great deal up front doesn't fit in a year or even 6 months. So this agile approach helps you kind of stay in touch with the boots on the ground and get to the end goal in a way that's kind of adaptive along the way. So as you think about these things, we need to be keeping in mind security and risk management. Um, but also for this roadmap long term, we need to see, okay, where are we going to be increasing our service line or adding new service lines? And then what technologies will we need and how do we optimize that overall in the future? Because building this is building digital services or mental health services or telemental health, telebehavioral health. See our previous webinars on the languages we use. Building these services, again, things change over time, and as we work on them and build them, we need to be iterating and learning lessons and optimizing, because it's all, a lot of the cost and effort is upfront. It's the magic, if you will, that people expect. Like when you pull up your iPhone and everything works on it, it's like, wow, this is pretty easy, right? That easy experience takes some work to do. So we're going to talk about the work that it takes to get there. It may seem a little overwhelming and scary, but there are methodical approaches that we can pick up and work with you on. But once you do the hard work and you iterate and you optimize, then at some point it does kind of feel like magic. It feels very fluid. It feels very efficient, but it's about changing an infrastructure and a paradigm and a workflow so that people are developing new habits and new ways of processes and ways of doing things, so that magic occurs over time. So one of the things I want you to be considering is, if a robot can do it, a robot should do it. This is scary for most people, but as you as you read about the future of technology and the future being actually right now, a lot of jobs are being automated. A lot of the check-in process that we would normally do is being automated. The calling people for to check on, are they going to be able to make their appointment? Remote appointment reminders are automated. A lot of these things can be done at a serious fraction of the cost of a human. That doesn't mean we get rid of their jobs. It means that we shift their jobs to something of higher value that a robot cannot do. So by robot, I mean anything electronic, anything automated. Or you might design a different way of doing something that eliminates a job. And again, it's okay to eliminate a job. You just repurpose that person for something of higher value that is more client engaging or quality control or things that only a human can do. So with that paradigm in mind, you start looking around and seeing that there are ways to do your scheduling, for instance, that can be automated. And scheduling is one of those that feels a little scary because it feels like it's out of control. But there are ways to set up the business rules, if you will, of your calendar. So you think, well, we don't want our client to see all those appointment openings, and that problem has been solved too. Or you might say, well, we might need flexibility. There are ways to build in business rules and those judgment calls that a human is making, where a software can make those same decisions. In fact, they're more reliable and thorough than a human in a sense. But it might be that you can't do all of that you want to do with one software. So you say, okay, what can we have 80% of our clients do with a scheduling software? And when there's an exception, have the exceptions handled by a human. So those are kind of a couple examples of thinking of, what can I automate? What can I change that would free up my staff to do higher level things, and then manual things like appointment scheduling and appointment reminders. So design thinking is if you haven't done design thinking before, it's kind of fun actually, but you basically empathize with a client, and you sit in their shoes and you say, what's the easiest, fastest, most convenient way to accomplish my goal? And then you sit in another person's seat, like the provider or the admin or the manager, and you say, what would I want at the end of the day that would accomplish my goals? And you basically create operations and shortcuts, and you try little experiments to figure out, will this work for us, and will that work for us? And so it looks messy on the page there, but you're basically learning little lessons along the way and trying out little experiments. to get to this end result. And I'm oversimplifying it, but that's kind of the gist of it. Um, but this prototyping and testing is part of that agile process that I mentioned that really helps you get to a very solid, usable thing. One of the big problems that we have when we're starting new services is that when we're working with a company that's starting new services, they will do things like buy the software first or buy a piece of equipment first and then kind of experiment with that. That's actually the worst thing to do. What you really want to do is define your services first and find very low cost ways of experimenting with it before you hire a service or before you sign a contract or before you buy equipment. You really want to test out these ideas and see if they're going to work out, because there's some lessons you don't know until you're kind of down the road with it. So this is again a low cost, low risk way of experimenting and learning what will work for your group and your patients. As part of that design thinking, once you're kind of settled on what you're going to work on and what you're going to develop, there are some other things to keep in mind. So this is a development process. It goes on a while and it's iterative. You're going to iterate and try things and experiment, but you need to stay agile, stay flexible, to keep your goals in mind, your requirements in mind. But sometimes your requirements are something to look at. They may not be actual requirements. It might be more preferences or high preferences. So you have to be careful on how you present those to yourselves and to each other to see where could things be flexible, where you don't really care how that happens as long as that's secure. Or you might say, I just need this consent signed and with this language on it. You might have different goals in mind, but how you present that to each other is important so that people know where there's flexibility. If you say we want to use a certain signing program, that adds a little bit of rigidity in there that may not be necessary. I understand sometimes people want to use existing technologies and existing rhythms, and that's really a good idea in many ways. But you might want to have a track of people working on that part, see how far you can get with your current stuff, and another pool of people working on, if we didn't use it at all, what would that look like? What would that cost? Because sometimes holding on to what you currently have is more costly than just starting with something new and importing all your data into a new thing. You also need some training in telemental health best practices. And I highly recommend a coach or a mentor. And of course, at the Mid-Atlantic Telehealth Resource Center, if you're listening to this, you're in our catchment area, and we have grant-funded mentorship and coaching available for you, consultation at the matrc.org website. So lots of resources are there online, and then we have some coaching, but it's important to have someone that really knows this industry kind of look over what you're doing and give you some advisement to say, hey, you have a requirement here that I don't see, and that we know is a good way to go. This other thing, not a good way to go because of X, Y, and Z. So you want people that have kind of been there, done that, to advise you on what you're doing, and get some of that oversight. And I would plan a little bit of money into that in addition, just so you can have a kind of a third party oversee what you're doing and give you advice over time. Also, your policies and procedures will change as you start to do this. So sometimes we plan on a new service and we plan on the funding for the service, and we're missing the part about planning for the organizational change itself. So when you're putting in anything new, you're kind of disrupting the status quo, and it might disrupt something in a good way or not in a good way. And sometimes there are unintended consequences. So that's why you want to budget a little bit of time and energy. And I would say even a project manager within your company, give them some space to think of, well, here's how this will change things, and here's how we will accommodate different things over time. A lot of times when we're dealing with an organization, I'll recommend that we try to parcel off half a FTE or even a full FTE to work on a project, because we want someone that's kind of outside the system developing a system. Because if you're asking them to do it 1 hour a day, it's just not enough time to really dive in and do a good job. So we want someone dedicated to making this work. And they're kind of the champion. You want to pick somebody that is not a technophobe. We've actually seen that a few times. But you want someone that's going to be a champion and can really put their heart into it. Because along the way, there are little challenges, and you want someone that when they hit a speed bump, they pop a wheelie and go over it. They don't just get stumped there. So picking that champion, picking the people that are going to advise the project is pretty critical. You want the people that are problem solvers, and not the people that are going to throw up red flags. We need to know about the red flags, but we need to take those red flags and turn them into solutions. The next thing is technology. There are lots and lots of technologies out there for telemental health services. The bottom line with this, if you're talking about video, is that video is not the hard part of telehealth. Video is actually more the easier part. There are lots of different video systems out there. There are only a few that are actually known to be HIPAA secure. And by HIPAA secure, we'll talk about HIPAA in a little bit, so I'll come back to that. But a lot of companies that say they're HIPAA secure or HIPAA compliant are quite, have something to be desired still there. But the hard part of telemental health is all the workflows around the video. So connecting to the client in the first place. How do you get them registered with you? How do you get them sign their consent forms and their agreements and get their financial information all in a HIPAA secure manner? That's the hard part, because your website contact forms and things like that, those all collect protected health information. And we need to be much better about learning the compliance regulations as the pandemic's ending and they're going to be enforcing them again. So the other part is, so there might be some things that you want to do in-house as part of your operations, and other parts that you might want to outsource. So there could be part of your screening or part of your management or some of your protocols that you actually could outsource to different companies. I know one company runs a chronic care management system with their chronically mentally ill clients, and they actually outsource that portion of that service, and they get a margin of that service still to finance their operations. But it's a separate remote team because they don't need someone on site doing that work. The other part I wanted to bring up, we covered, is starting small and iterating the Agile process. We did Agile planning. This is more like Agile development. So as we start to implement something, we want to develop a little bit, test it out, see if it's user-friendly, see if it's what we want. Try it with a few clients or mock clients. Try it with some people in your operations. You say, this is working, this is not working, this is what it would take to make it work. This kind of process overall is something that needs to be planned into your plan for rolling this out or developing your service. You need to plan more time and more kind of funds to have the staff available to do this kind of work. So as you think about adding telemental health to this, again, some people rush into this, and quite a few of us rushed into it in the pandemic, I know. We might be thinking about, hey, let's use this app or let's do this other service. There are a lot of companies out there that are saying that they do in depression screening, or they do, an anxiety management module. You need to take a look at these things in a little more detail before you do that. So investigating these apps that are out there that you might want to incorporate, you need to be thinking about the time it takes and some of the cost of investigating, because they're not all as they say they are. So you need to investigate and say, are they evidence-based, or are they based on evidence? So some that claim evidence-based might just mean that they are, say, cognitive behavioral based, but they're not. The app itself has not been in a research project where the app has been validated. They just say that it's based on cognitive behavioral health that is validated, and therefore they kind of claim the same weight of research that I think is not a good equivalence. So it's important to as you hear those words, go and vet that as well. So have a provider go through the app and say, does it actually do what it says it should do? Are the components and the modules clinically sound? What theory are they based on? And were they made with the help of clinicians, or were they made just by some guy that's a coach that also loves technology? There are apps out there that are made by technology companies and venture capital companies that are not actually well researched. And there are others that are very well researched and very well put together. The other part is, are they well written, or are they clunky to use? You can have something that looks great in the marketing materials, but then it kind of misses some key points of the process. So you really want to try out these apps before you incorporate them into your service. But I really think that we need to be incorporating more apps. So I don't want to be down on apps at all. We help make apps, but it's important to think about, do they really work the way you want them to work? And are they really clinically sound? And do they really help meet the client's goals? Or is this just something that we're kind of adding to our service that doesn't have the therapeutic effects we want? Another angle to take on this is the operational planning. So we look at designing and developing; those are agile processes, and we look at our clinical work. Do these services meet our clinical goals? But in our operations itself, anytime you're making a change, there is a change to operations. And I think it's smart and less stressful on your team if you kind of say, here's where we want to go, and we need to have you think through what are the implications here if we start doing this, we start experimenting with this. Can we experiment, first of all, in a way that doesn't disrupt everybody? Can we have one or two clinicians work from home and divert some, maybe dedicate an admin to those people and funnel some clients to them and experiment with how this all works without disrupting the mothership. So you kind of have your speedboat and your mothership. That's one kind of way of experimenting without, interrupting everybody. You also might want to kind of develop things with one or two champions so that you don't have other people that kind of get in the way of the process. You do want input at some point, but usually your champions can develop that input for you and help you iterate before you, get other people, disrupting the process in a way. So another part is testing. You need to test whatever ideas you have and test them a lot. And test different variations of them. So a lot of times we'll test something out and it works perfectly fine until we get somebody else to test it, and they do things in a different way because we started simulating what a client would do on their own. A client doesn't have somebody next to them telling them what to do. They're just asked to go use this app. And so does the app give them everything they need? Did the email that we sent out that we thought was brilliant and very explanatory, does it really work? We want to test out those ideas to make sure that it really is user-friendly by experimenting with other friends and family or staff, or with other a small pool of clients, and then you ask for that feedback. So a lot of times our perspective is different after we get that feedback. So this is part of, I mentioned this, and this is a lot of just logic, of course, but these are things that you need to plan into your operational paradigm as you're thinking about the future, your near-term changes and your long-term changes. You need to be planning this process as part of the cost of doing this program. So before I go on, some obvious things here are, what are your communication and what are your billing workflows? But one of the things I think is often overlooked is if my client has an emergency at a remote location, what will I do about that? Because in telemental health, you can't tell them to just hang up and dial 911. It's somebody that could be suicidal or have already taken drugs or something and have a critical incident. So in an emergency, you need to stay on with the client and have a way to connect with emergency services. So this is one of the operational things that is often overlooked when you're developing a digital service or a telehealth service. So that's got to be part of your planning. And we talk a lot about emergencies and what to do about them and how to plan for those in the best practices course and in our emergency response course. Management. Management is an often overlooked item in telehealth, but I'm a clinical supervisor, and I owned my own set of 4 clinics. I ran a clinic network of 28 clinics in Michigan. I had to be thinking about how do I, how do I keep this ship afloat? How do I manage and make and oversee everything and make sure people aren't doing things goofy in a goofy way or a non-compliant way? How do I make sure they're doing quality? How do I have quality measures embedded into our telehealth systems? There are several ways to do that by embedding pre and post measures. You can do PHQ-9s before and after. You can do check-ins throughout the week and feedback surveys. They can be just one item, smiley face after a session to say, how was my provider today? And that kind of feedback can be given to the management only or to specific clinical supervisors, things like that, to embed your quality control as part of your service. Just because it's telehealth doesn't mean that you have to give up on being a manager and expecting quality service. In fact, the same standards of practice apply online as they do in person. So think about also what's your permission structure that you need to be implementing, your policies, procedures. These are all things that I would say take some time to develop. And that's where you would need a mentor, coach, or consultant to help learn what needs to be in place and review what you've provided or what you've created to make sure that it's thorough and you're not missing anything big. And then another big component of that is how do you get the data that from these sessions, the length of your visits, whether they no-showed or not. There are lots of pieces of data that you're going to want to see to manage your practice. And those need to be included in your planning and your kind of requirements up front. Also, are there maintenance costs to what you're developing or what program you're making? And are there kind of check-in points, milestones where you check in and say, what needs to be updated here? And when does this need to be changed and modified? Because technology changes and the needs change over time. And so your program can kind of get outdated if you don't keep up with it. Part of future proofing is to make whatever you're making easy to change in the future. So some things are rather difficult and you don't want to commit long-term to anything because more than a year out, it's hard to know what you're going to be doing in a year because the market keeps changing, technology keeps changing, and the ways we serve people are ever evolving, right? So I would recommend not getting involved in long-term projects. You usually can get a deal with a year or two, but I wouldn't go beyond probably 2 years on any service contract, just because you're going to want to, continue to iterate and change over time. So software planning is a big deal in a seminar all on its own, but I just want to bring up again that as the pandemic is changing, the HIPAA security rules are going to be back in enforcement. They never said that you don't have to do HIPAA. They just said they're not enforcing it, but they are expecting you to abide by HIPAA compliance standards. And also your licensure and ethics are requiring you to keep this data private. A lot of software companies are not as secure as they claim, as I mentioned. And you need to think about the laws and some of your workflows as you're planning your software needs. Sometimes your EMR can do this, or sometimes you just need another layer of services that can do this in addition and integrate with your current services. There are lots of options there. As we're talking about this, just to level set, you can have video that's HIPAA secure, text-based services that are secure, cognitive behavioral therapy modules, or even apps that are HIPAA secure. But every app and every app maker is a little bit different on what they mean by these terms. So it's good to vet them. And we have some resources at MATRC on identifying HIPAA secure vendors and how to kind of double check some of that. There are a lot of apps for behavioral health and mental health. I put them in 4 buckets. One is there are apps for therapists, there are apps for therapy, there are apps for self-help, and then for therapy students. So when you're looking at apps, you want to think they probably fit into one of these 4 categories. And I have a comparison site at the bottom of the page if you want to click in telementalhealthcomparisons.com. It shows a lot of them there. It doesn't mean that they're all really good ones. It just means these are ones that are advertising their services. What you can use apps for is a lot of engagement. Basically, you want to keep people engaged in their treatment. So you can do that by sending encouraging messages. You can remind them of their goals, remind them of the solutions. These can be pushed from the provider to the client. There's lots of different ways to do this, but you can remind them their appointments and communicate with them in much more efficient ways than by telephone. There's some clients that prefer telephone and will always use a phone. And of course, you need to have someone that mans the phone. But you can handle a big chunk of your clients really like using apps and are happy to do that. You just need to make sure that they're HIPAA secure apps that you're using. You can also use them for support in different ways. So this is an example of one where they're kind of doing some gamification, kind of rewarding and getting them excited and enthused, connecting the client with other people in their cohort. Maybe they're in group therapy together or have gone through drug and alcohol treatment together, or any kind of group service. And you can have them connect and have a message board where they're connecting with each other and helping each other throughout the week. And that could be moderated by a clinician. Or you can have an easy way to set new appointments or cancel their appointments or send quick messages to their provider. Of course, some of those have operational implications. And again, there are ways to solve each of those issues that come up. We've talked about triage in the past. This is a very simple triage system. As you're planning, I highly recommend that you start including some triage, because there is this growing number of patients and not enough providers. So getting them to do some kind of self-check, to get them into some kind of self-report, like a PHQ-9 or a GAD-7 or a DAS. And then that can lead, the results of that could lead them to other services. It could be like a virtual expert system. So screening, brief intervention, referral, and treatment. So all these can be done electronically with a flow. So you can, basically, as you're designing your systems, you can include multiple layers of interventions and a workflow that includes them all. As you're developing your services, remember that you have many different components to this, different points of view: the client, the provider, the referral source, the payer. All these different angles are really important. So you can use this as a checklist to think of, okay, with this idea, what implications would it have on all these different points of view? And you can, if you have a bigger company and different departments, you can take your idea and shop it around and ask for the feedback in your design and development iteration. Apps on the App Store, you might be really keen on using some of the apps that are out there. And there are some pretty good apps out there. I like a lot of the DoD apps, but there are some venture capital money put into here. And it's important to be kind of buyer beware. There is a serious lack of privacy, and a lot of the companies are not HIPAA compliant from what I can see. And some of them really violate provider license regulations. So it's important to really think that this technology company is working for themselves. They're not working for you. So they may not have your best interest in mind. They are trying to connect people with providers, or they're offering a service, but you are still responsible for your licensure, and you're the one that will be in trouble. So you need to be, have your criteria, make sure that whatever service you're using, it might be convenient, might be, lucrative, but it may not be the best fit for you as well. So something that I like to point out, that if a service is free, it's free for a reason, right? So if it's free, you may be the product. You and your clients may be the product. That means they're taking your data and your usability, and they're taking that data and they're doing something with it. They're either selling your name and your email address, your preferences. The fact that you're a provider could be sold to other companies, and they use that data to sell advertising to you or other things. The reason HIPAA was created in the first place was to connect people together with their data securely, but also keep it out of the hands of bad actors that would deny them insurance or other services because of their diagnosis or because of something happened to them medically. So keep in mind that if a service is free, it really should be vetted and looked at carefully to see, are they selling your data? Are they as compliant as you need them to be? Just a recap on our technology, because we could do a whole nother seminar on just the technology part. There are, lots of use cases, and you want to make sure that you're identifying your use case first, And then are these things, usable that you're putting together? There are services like the one on the screen where you can integrate several different apps, different services together as kind of layers, and you can roll them out one by one over time. Just make sure that they're secure. As you're looking at security itself, you need to look at the jurisdictions. You don't want to operate in an area where you're not licensed. The licensure laws for telehealth and telemental health, telebehavioral health, all are focused on where the patient or client is located at the time of services. So if they're located in Kansas, then you have to have a Kansas license, and the Kansas Licensure Board could report to your board and ding your New Jersey license or wherever you're located. So notice that's very important. You want to read the privacy policies of whatever you're using, because that's where they're required to tell you how they're using their data. And then you need to look at what is the security of the data itself. When you're looking at HIPAA compliance, there should be a very long list of things that they do. Like our software has pages of things that we do for HIPAA security. If they just say encryption, I would keep on looking. So this is a quick kind of fun thing if you're still paying attention. I would like you to do me a favor for a minute and go to the chat box. If you, at the bottom of your screen, click on chat. I would like you to take a moment, and this is a little pop quiz for you. I'd like you to look at all these logos and put in here the number you think is goes to the real HIPAA compliant logo. Look at these, and each of these, I'll give you about 30 seconds. Which of these are the real HIPAA compliant logo? Just type in your number real quick in the chat box. So which of these is the real HIPAA compliant logo? Is it number 1, number 2, number 3? Somebody said number 8. Somebody said number 1, number 3. It's tricky, isn't it? Can you discern which is the real HIPAA compliant logo? Someone says 6, 5, 5, 5. Okay, we're closing it down. Take your final vote. Which one is it? Okay, the answer is none of these are the real HIPAA compliance logo. None of these. All of these are wrong. Every single one of you is wrong this time. Sorry. All of these are what we call marketing. These are marketing. There is no official HIPAA logo. So what we do as software vendors is we take that cool little wing snake thing that looks medical, and we put it in HIPAA or put it next to HIPAA, and we look like we are an official seal. And so we put these logos around to kind of as a little place marker to tell people, hey, this is HIPAA compliant. But the thing is, software itself cannot be HIPAA compliant on its own. It takes a human to do some of the things that are required by HIPAA. So even though you get a software that says it's HIPAA compliant, that doesn't mean that every part of the process is HIPAA compliant. You need to dig in the details and understand what that means, because sometimes they're protecting some of the data and not all the data. Zoom was just settled for, I think, $58 million for selling data to Facebook. There are things like that are going on behind the scenes that you have to read the fine print and find out what is really happening. So this is a symbol that would tell me as a consumer, they're doing something on HIPAA compliance, but what exactly? And that's where you want to ask them, I need a detailed list of what do you do for HIPAA compliance, because every vendor defines it a little bit differently. Also, HIPAA compliance is expandable. It depends on the size of the company, and it depends on the size of what you're doing in the organization. And there are several parts of it. There's an administrative part, there's a technical part, there's a physical controls part, and then there's a privacy policy part. So it's likely that these vendors are doing one or more parts of the parts and not all of it. So you as a providers still have to do a breach notification plan, and you need to log your users and have control over who has access and be monitoring these things. And there's a whole HIPAA class you can take on what you need to be doing. But I just want to open your eyes to, you need to plan for HIPAA compliance as being a major component of whatever telehealth services you're doing, because the old HIPAA compliance of in-person services is much different than the digital version of HIPAA compliance. And in case that wasn't enough, there are fines for this. And so again, I don't mean to scare you, but I do want to just sober you up here a little bit that the fines are very real. And I want you to look at the top left corner under circumstances of violation. The first one is called entity did not know or even reasonable diligence. So this means if you didn't know, you still get a penalty, $100 per violation. So that could be per patient record over the many people that are many patients you have. So realize that I didn't know is still has a fine to it. So it's important to get an education on HIPAA compliance and how to do that when you're doing digital services. So we're near the end here, and I just wanted to point out that the patient data is the key part of that HIPAA compliance, and the patient data it's difficult. And so the little thing on the screen kind of gives kind of a little example of why it's difficult. So there's different data structures. Sometimes the data is structured data where the first name is in one box and the last name is a different box. Sometimes it's one box, and it's hard to port that data to another software or protect it in certain ways because the data is structured a certain way. Where the location of the data is it on a laptop or is it in a cloud? Are they protected in certain ways? Are the formats compatible with each other if you're different programs? Do they have the same definitions? What's the complexity of the data? And are you looking at the requirements, the regulations of this data, or have you outsourced it somewhere? So it's important to keep have somebody focused on this. It's usually your privacy officer in your company. Big or small, your company needs a privacy officer that basically understands HIPAA and takes responsibility to make sure you're protected because the consequences are pretty big. So as you're planning for your future digital services, you need to plan this as a big chunk of your budget and your time to make sure this is nailed down, or that you're hiring somebody that knows this well and can help you guide you on what you can and cannot do and how to do that efficiently and effectively. Once you are doing it well, there is magic, to be sure, of sharing information across business lines, across in appropriate ways with appropriate consents to different medical providers, mental health providers, to do care coordination or to include the family, or to even help them match with other resources in the area. You also I have a link down here, the patient's right to access their data. This is a requirement where the patient has a right to access their data. So as you're planning your systems, you have to plan a way for not just for management oversight, but a way to extract that data and give it to that patient. Because if you don't plan for that, that could be a costly venture down the road. So you want to get ahead of that and plan for that. So as we wrap up here, I know a lot of the things I'm giving you are kind of bad news, but I also want to raise your awareness to it. We plan in this very fluid. If we just do these things, we'll be fine. But success really is a lot more messy, as you guys have done these projects before in your past. However, the rewards are truly great, and what you're doing is you're building blocks for future generations and even future service levels to help more and more people in more comprehensive ways. And truly, you'll be able to save quite a lot of money and make your providers happier. I particularly like to tell people I am allergic to typing. So anytime I can automate filling forms with current data that I don't have to retype things, or I can do check boxes instead of typing a lot of stuff. There are things like that can be implemented as part of this process that really make it all worthwhile. And that's why we began and we end with why. Why do this? Because many reasons, but I think because you'll have better operational efficiency, fluidness, patient satisfaction, provider satisfaction. So there are risks to this, of course, and there are potholes and lessons learned that we can share with you. And but we can say with certainty that we've solved the majority of these problems already multiple times in multiple ways. And of course, as consultants for the Matrix and other companies, we're happy to help you guys at whatever level that you're interested in it as well. So I want to give you again, while we're wrapping up, a resource. We have technical assistance available at matrc.org. I'm there every other week. I'll be there this Friday, open office hours. If you go to matrc.org website, there's a link right in the middle of events. Probably has my picture by it, and it's a link to a video between 12 and 2 where I answer random questions for about 2 hours every week or every other week. So I'm there to do free consultation and off other hours as well. But you're welcome to join me and ask whatever questions you have from this or other webinars as well. Caddy, I want to turn it over to you. And also need to say that we have a couple more resources if you want to download the slide deck for you guys.
Yes, thank you so much, Jay, for providing us with such wonderful information, especially on the HIPAA compliance platform. That was very eye-opening for us. And I guess everyone was able to chime in the chat box. So at this time, I'd like to invite you to share any questions that you might have for Jay in the chat box, or you can also use the Q&A pod located at the bottom of your screen on the Zoom webinar platform. But in the meantime, while you do that, could you please move the slide deck over one? Thank you so much. So what you see on your screen is our evaluation QR code. If you have a mobile device, you can scan or hover over to scan the QR code to take our short evaluation survey. I have also entered the survey link, if that's easier for you, in the chat box. And also, like I mentioned before, the MHTTC network is funded through SAMHSA, and as part of receiving this funding, we are required to submit data related to the quality of today's event. This survey is anonymous, and so we welcome all of your feedback that you may have. Also, Jay, I believe we're at the top of the hour, and I don't have any questions submitted in the chat, so I just wanted to remind you, our participants, that are next week, we have session 5, and that will be on what telebehavioral health and digital mental health infrastructure to build now and what can be built later. It will be the topic. And do you want to provide maybe a teaser regarding next week's session?
Yeah, we're going to be talking about the building blocks that you need to be putting in place now that kind of helps you iterate along the way and prepare you for growth in these areas. So we have quite a lot to cover next week.
Wonderful. So everyone, thank you again for joining. We apologize earlier for the technical difficulty we experienced earlier. We're glad that you were able to rejoin us. And you know, like I said, if you have any questions in the meantime, please feel free to contact me directly. My email is on the screen. Also, I will put it in the chat. And I guess that's all for today. And we hope you have a wonderful day. Thank you, Jay.
Thank you.